Hi, my name is Frances Isbell. I'm from Gadsden, Alabama. I went to college at Samford University, and now I'm a law student at the University of Alabama School of Law. I have a type of muscular dystrophy called spinal muscular atrophy, and I hope to practice disability rights law after I graduate from law school. Just to tell you a little bit more about myself, I've had a lot of great internship opportunities. I was a law clerk at the Alabama Disabilities Advocacy Program, which is in Tuscaloosa, Alabama, and I also interned at the Administration for Community Living with the Department of Health and Human Services in Washington, D.C., and I was an intern for the American Association of People with Disabilities, or AAPD. Today I just wanted to talk to you about what it was like for me to transition into living independently and how I developed as a self-advocate through that process, and share a few of the pointers that I learned as I went through that process myself. So really, when you're in high school, the best thing to do is to really start learning about your rights early on in the process, to give you an idea of a few of the laws that you should start looking into. I kind of compiled a list for you today. First and foremost, you've probably heard of it, but the ADA, the Americans with Disabilities Act, is the most important civil rights law for you as a person with a disability. But there are quite a few other laws that a lot of people don't spend as much time researching, but are still very important to you. There's the Telecommunications Act, the Fair Housing Act, the Air Carrier Access Act, Voting Accessibility for the Elderly and Handicapped Act, the Rehabilitation Act, the Architectural Barriers Act, the Individuals with Disabilities Education Act, the Civil Rights of Institutionalized Persons Act, and the National Voter Registration Act. There are quite a few different resources for you to learn more about those laws, but the first place I would probably look would be to your local independent living center. In Birmingham, that's Disability Rights and Resources, but we have a couple of other independent living centers throughout the state that you can reach out to. So I would start doing that early. They're very complicated laws, so that's something you'll be doing for a long time. But you need to know your rights to make sure that other people adhere and make sure that your rights are followed. So that's one thing that I would do. Also, you really need to start looking into how Social Security works, how disability works, because you really want to apply for that early on. That's a huge resource that opens a lot of doors for you. You really want to try to have that in place when you turn 18. It's more than just getting a check that helps you live independently. It's also about qualifying for Medicaid, which means you get health care for one, but it also means that if you need it, you can get personal care assistance, which you qualify for by applying for a Medicaid waiver. But all of those programs are interconnected, and so first start with Social Security and then start looking into Medicaid waivers. Again, you need to do that early on because Medicaid waivers can take years. So if you want to get on their waiting list, you should start as early as possible. There are a lot of attorneys who can help you with all of those things, so start researching attorneys. The best resource that we have for this state is the local Protection and Advocacy Program, also known as Alabama Disabilities Advocacy Program, which is where I worked as a law clerk during law school. They do a lot of different things for people with disabilities, but they're a great starting point, and they'll either help you with your legal issue or they'll point you to another attorney who can. And they provide free services for people with disabilities. So definitely contact them. You can find their contact information on their website. And there are a couple other resources that I would definitely look into as you start to plan your benefits. So again, Disability Rights and Resources is a great resource. They help you with learning how to sort of manage the different benefit systems. And also there's another program that you should start looking into. It's called ADRS, Alabama Department of Rehabilitation Services. And that is specifically if you are trying to go to school or trying to find a job if you're a person with a disability. And they provide a lot of different services, but with benefits, they can also provide counseling for you as you try to manage the different benefits programs. And with ADRS, they're a great resource with trying to get personal care services set up. A lot of times they'll work with Medicaid, and you'll have counselors who sort of manage both programs and counsel you on how to deal with your different services. Two big things that you'll need to start looking for are accessible transportation and accessible housing. Disability Rights and Resources has a list of accessible transportation. The best option in Birmingham is Class Tran. If you apply for Medicaid and receive Medicaid, they can help with transportation to some doctor's visits. And then there's Medical Transport of Alabama for emergency transportation. But there are a few other options. For example, there are a couple of accessible taxis in Birmingham, but one thing that you want to be prepared for is that you have to apply for all of these transportation services, and so you need to do it beforehand. And it's a process that takes time, like most things with disability services. And so again, to start that early, there are different transportation services in each city in Alabama, but each of them have an application. Usually what it entails is a form. It's a few pages, but then a lot of times you'll have to get your doctor to explain that you have a disability and how it affects your need for transportation. Start looking into those services. For housing, Disability Rights and Resources also has a program where they help you find accessible housing. So I would take advantage of that. It can be sometimes hard to find, and that process takes longer depending on what your needs are. If you need an accessible bathroom or if you just need wider doors, those are all considerations that you need to think of. Now, if you're trying to go to school, one really important thing is to know that you have to apply for disability services with the Office for Disability Services at your school. It's a little bit different than what you went through in high school. And so again, that's another process where you have to have a doctor explain your accommodations. You don't automatically get them. So you have to explain why you still need them and how they apply to the classes that you'll be taking and the setting that you'll be taking them in. And that's kind of a process that you'll keep doing throughout your experience as a student. It's something you have to update every semester. It's not automatic. They don't just stay in place. You have to go visit with the Disability Services Counselor and keep your documentation up to date. A moment ago, I mentioned that you should look into Medicaid waiver programs. There are several different programs in Alabama. There's the Elderly and Disabled, or E&D waiver program, which, as you can tell from the name, is for people with disabilities. And the State of Alabama Independent Living Waiver Program is another one. It's also referred to as the SAIL waiver. That's individuals who are at least 18 years of age with specific medical diagnoses. And generally, for that program, you need to meet the criteria for Medicaid coverage in a nursing home, but you prefer to remain at home or otherwise in your community. There's the home and community-based waiver for persons with intellectual disabilities, or the ID waiver. There is the HIV and AIDS waiver program. There's the technology assisted, or TA waiver for adults program. That program is for people who need to receive private duty nursing and who are at least age 21. There's the living at home, or LEAH waiver for persons with intellectual disabilities. And there's the Alabama Community Transition, or ACT waiver. That program is specifically for people with disabilities with long-term illnesses who are currently living in an institution, for instance, like a nursing home. I also brought up the Alabama Disability Rehabilitation Services, and that program, like I mentioned before, does a lot of different things. One thing that's really great that they do is they can help you train with adaptive driving, which is really the best way to learn how to drive if you have a disability and you need certain accommodations. So you'll want to apply for that service with ADRS. They can help you with getting different technology you might need to make the classroom accessible, or conversely, if in a work or office setting, you might need an accessible desk. They can help with that. They can also sometimes help you with making your home accessible, and actually Medicaid can help with that too, with certain instances. As long as these different services in some way help you towards your goal of finding a job and remaining employed, ADRS can oftentimes help you with that. And they can at times help with personal care. They can help with tuition, books, different things that might fit into sort of a plan for employment. Before you start your first job, you really need to look into the employment laws also and how it intersects with the ADA, because you need to know how to introduce your disability, or even if you want to tell people about your disability. There are a lot of different safeguards for you, but you need to know what they are, and you have the right to ask for accommodations in a workplace setting, but you want to do it the right way and at the right time, because sometimes employers don't do the right thing, and so you need to know what your rights are. I've mentioned applying for different benefits programs like Social Security or Medicaid, and through those programs you might need to find different doctors that are approved through them, and so that's something new that you'll have to do, is you'll have to make sure that you're finding physicians that are approved through your new benefits programs. And that's something that you'll have to start doing on your own, is to see which medical services are approved. Oftentimes you have to call your insurance program and see if a medication is approved. And something that was different for me as I moved off my own is that I started managing my own medications, managing my doctor's visits, and small things that you didn't think of, may not have necessarily thought about before, are transportation to those doctor's visits, or scheduling them around your classes, or one option that's great with medications is finding a pharmacy that delivers to you. A lot of pharmacies do that. All you have to do is ask, and sometimes it'll be free, sometimes they might charge you an extra $1 or $2, but it can make life a lot easier if you can find different things that deliver to you. And When you start going to these doctor's visits, you'll want to make sure that you're the one who's trying to carry the conversation, and instead of your parent. And I like to have someone with me at my doctor's visit still, but it's important for you to be the one who's prepared at the visit, and the one who has questions, and the one who is listening to what the doctor says, because all of a sudden you're the one who's applying that, and you're the one who's managing your health care for the most part. And depending on your medical condition, your needs may change, but those are things that I would look out for, and we'll have another expert who can give you more guidance on that. I've spent a lot of time explaining different resources here in Alabama, and also just kind of explaining different national laws that are helpful to you. But I think something that's really important for you as you transition is to try to connect with other people with disabilities and find mentors. That's something that has been really important to my life, because you need to talk to other people who have gone through what you're going through right now. It's a difficult process for anyone who's transitioning from living at home into going off on their own and finding a job, but it's often much more difficult for a person with disabilities, with a disability or multiple disabilities, and it's really great if you can find a community. There are a lot of different advocacy organizations that you can reach out to, or you might find a group at your school, or in your maybe even at your place of employment. So that would be my closing remarks. Thank you for giving me the chance to share my story. And again, many of the resources that I've brought up, there are similar resources in other states. For example, every state has a protection and advocacy program like ADAP, or Alabama Disabilities Advocacy Program. So if you are in another state, you can look for the same programs. Every state also has independent living centers. Those are two of the best resources for people with disabilities.